Cervical screening is a health check for your cervix. It is not a test for cancer, it's a test to prevent cancer. If you have a cervix and are aged between 25 and 64, you will be invited for regular cervical screening as long as you are registered with a GP. This invitation will come automatically. You'll receive your first invitation in the months leading up to your 25th birthday, and then you will be invited every 3 years until 49. From 50 to 64, the frequency of cervical screening changes to 5 years, and this is because there is a reduced risk of cervical cancer as you get older. Anyone can get cervical cancer, but the risk is so much lower below the age of 25 and over 64, which is why the screening programme only occurs between those ages. We know the incidence of cervical cancer is actually highest in the 30 to 35-year-old age bracket, which is why we encourage everybody to get into the habit of regular screening as soon as they are invited. The single biggest risk factor for getting cervical cancer is not being screened. .7% of cases of cervical cancer are caused by the HPV virus. This is why in 2016 the test was changed to first identify presence of this virus. HPV is the cause of most cases of cervical cancer, and it is transmitted through skin-to-skin contact. Therefore, it can be transmitted through sexual activity between two women. In the past, it was thought that HPV could only be transmitted through heterosexual sex, but we now know that this is not correct. If you have never been sexually active, then your risk of cervical cancer will be lower. However, that does not mean there is no risk, and we would still encourage you to attend your regular screening.
Hello, my name is Wendy and I'm a practice nurse. When you arrive for your appointment, you'll be seen by a practice nurse like myself. I'll call you into the consultation room, check your details, explain the procedure to you and answer any questions that you may have. Of course, you'll be given some privacy to get ready for the test. Depending on the room, we can stand outside or you'll be going behind a curtain, and we'll give you something to cover yourself up with. And don't worry, I'll show you where I need you to be and get you as comfortable as possible. At this point, I'll insert a small speculum into your vagina, and then I can open this to find your cervix, where I'll take a quick cell sample with a soft brush. It's never going to be the most pleasant thing, but hopefully it won't last for long. And there are things that we can do to make it more comfortable for you. If at any time you want me to stop the procedure, that's all you have to do, say stop. Sometimes changing your position can help, or we can use a different size speculum or apply more lubricant. We will always listen to you and try to help you and make it as quick, easy and painless as possible. To help you relax, you are welcome to bring something to listen to read, to do your breathing exercises, or even bring somebody with you for support. Then I'll give you some privacy to get dressed again and you'll be free to go. The whole appointment should only take about 10 minutes. You'll get your results in the post within a few weeks. Most people do not have any HPV present, and you'll be re-screened again in 3 to 5 years. If some signs of HPV are found, then please don't worry. It doesn't mean that you have or will get cervical cancer. It means that we will probably bring you back for a test sooner than you would have expected. If high-risk HPV cells are found, you'll be referred to colposcopy at the hospital, and they will carry out a normal, straightforward procedure to remove these, which will hopefully lead you back to normal screening.
I was extremely worried about my first cervical smear because I suffer with anxiety, but it lasts less than 5 minutes and the discomfort lasts for seconds, if that. It was nowhere near as bad as I thought it was going to be. The nurses are really good, they know what they're doing, and there's loads of things that they can do to help make it easier for you. For example, they can get you a smaller speculum, or they can get someone who can come in with you. I ended up having to have some cells removed, and although that was really scary, it was a lot better than the alternative, and I'm so glad that I went for my cervical smear, and I wouldn't have found that out if I hadn't gone for my screening. I'm 28 and I've got quite a few friends who haven't been for theirs yet, so I've been really encouraging them to go and get it done because it's so important. The thought of it is definitely worse than the actual thing.
Hi, I found cervical screening to be always a relatively easy procedure, and I found that the nurses that have performed it have been very friendly, helped put me at ease and kept things cheerful and light throughout and kept me informed.